One of the biggest questions when someone calls my clinic is, does it treat ... Insert whatever you want here. And that question is a loaded question. First of all, we have to be careful around legalities as to what we treat and what we don't treat in regards to the word diagnosis and treatment, because it's on a different paradigm. It is talking about the allopathic biomedical paradigm that most people in our country are accustomed to. And we don't treat diagnoses. I know it sounds confusing, so we're going to jump right in, and I'm going to explain and address what we treat, i.e. what we help with. I'm Melissa Lone, doctor of acupuncture and Chinese medicine, and this is But I Don't Like Needles. I could address this from a biomedical viewpoint and give you a list or a slew of diagnoses and say, yes, we help with this. I have seen blood pressure reduce, yes. Have I seen cholesterol levels improve? Yes. Have I seen people come in with pain and leave without pain? Yes. Have I had patients struggling to get pregnant? Yes. But I challenge you to look at illness through the lens of an East Asian practitioner. See what East Asian medicine sets out to do. Think of your diagnosis as the branch of the tree. You can treat the branch all day and all night, but if the roots are rotten or not watered, or they're drowning in a swamp, none of it matters. The result in caring for the tree as a whole will bear fruit and cure disease. Curing the disease is a side effect of you getting well. When a fertility patient comes to me, it's very difficult to not obsess about the end result of having a baby, understandably so. But we are missing the fundamental steps of getting the woman and the man and the relationship well, whereas the fertile ground is primed and the pregnancy is a result. It's important when addressing what acupuncture and herbs treat to keep the focus on our scope of East Asian medicine. Our primary goal is not to treat disease per se, but to treat the person. It is a shift of mindset. For example, when a person asks me, do you treat lupus, which is an autoimmune condition? I tell them, well, I put you in a state where we increase circulation, we improve lymphatic drainage, we increase fluid metabolism, whereas taking the load off of the liver, kidneys. In addition, we get you out of fight or flight, that sympathetic response that occurs when you're in stress mode. And that results in a reduced inflammation, improved metabolism, and reduction of stress, resulting in an inactivity or a reduction of autoimmune flares or reoccurrences. It is in the belief of East Asian medicine that when the body is performing at best, it will reduce the chances of chronic disease. It's about identifying what we are putting in our body, on our body, and what we're doing with our bodies that is causing dis-ease. Dis means not, ease is obviously ease, not good, dis-ease, not in a natural state. By recognizing the patterns and imbalances of the body that are disturbing homeostasis of either hot and cold imbalance, excessive deficiency imbalance, what we would consider yin-yang imbalance, etc., we pinpoint what we need to do individually to compensate for those imbalances. This involves acupuncture as well as diet, lifestyle, and genetic predispositions. So when a person comes to me and they say, do you treat, insert here, I say we can help, insert here. In my opinion, the major underlying cause of illness in the United States starts with the health of the liver and the kidneys, as well as a pH balance of the gastrointestinal tract. The liver is a very busy organ. It gets beaten up and taken advantage of all of our lives. It is responsible for not only helping to clean out the body, but it also makes blood, which is in charge of carrying our oxygen, and it repairs cellular damage. But it is also in charge of making fats, which is crucial in hormonal health, neurological health, and balancing our cholesterol. When the liver is encumbered, it directly relates to our level of inflammation and our hormonal transitions around puberty, menopause, and all stages of the menstrual cycle that contribute to fertility. The kidneys, when disrupted, interfere with our adrenal system, and the adrenal glands sit right on top of the kidneys, and they relate to our sympathetic parasympathetic nervous system, which directly relates to our digestive system, our nervous system, and our reproductive system. Our pH balance is in the gastrointestinal tract, directly relates to inflammation and our immune system. We live in a highly acidic culture. Our diet is acidic. Most people live on pasta, bread, and red meat. All of this is extremely acidic. Add on top of that we add preservatives and growth hormones that contributes to even more acidity. Now another layer is the majority of medications that you take, and that adds to an acidic environment. An acidic environment is a playground for viruses, and with this balance being off, we are unable to absorb the nutrients we need, thereby leaving us deficient and malnourished and our immune system compromised. One of the basic things that people don't understand is that our nasopharynx, around our nose and our mouth, where we breathe in, anything from the air, again, environmentally, toxins come in. This is our first line of defense. So when you're constantly having inflammation and you're constantly having postnasal drip, that means you're in a constant state of inflammation. Your nasopharynx and your tongue and your mouth is related to your gastrointestinal tract. It's all part of that. And the first place you're going to notice inflammation is there because it's going to obstruct your breathing. But just understand that that is just one part of your entire system. And in our medicine, and I think that most people will agree, there's no compartmentalization there. Once you have inflammation, it becomes systemic. In regards to this toxicity that's coming into our body, autoimmune patients come into me and they say that they have postnasal drip. Yeah, they do. They have an underlying inflammatory system. And if you live through life thinking that you have postnasal drip and it's just allergies, you might want to take a second look at that. Because that postnasal drip or constant little aches in the body or in the bones or bloating, etc., these are signs that something is inflamed, something is not moving smoothly, and it's not optimal. And when you are in a state of inflammation, you are leaving yourself into an acidic environment, which is leaving you susceptible for viruses and infections, as well as inflammation, which is going to cause discomfort and pain. And it also disrupts your metabolism and in digesting your food. So the purpose of TCM is balance. We all have an individualized predisposition or propensity for getting out of balance. And yes, those are genetic. However, they can be turned on and off. And that depends upon your inflammation. And that inflammation is related to perhaps your diet that's not working for you. It could be related to your lifestyle, or it could be related to a metabolic issue that you don't even know you have. But we handle these imbalances differently, and they need to be addressed specifically. Yes, men's bodies are different than women's bodies, so they need to be treated differently. Yes, our bodies are different in our teens and our 20s from our 40s and our 60s. And so those need to be addressed differently. And yes, we each individually have unique imbalances because of our lifestyle, because of our choices. And those need to be treated differently and individually. And that is what is so wonderful about East Asian medicine. We treat you specifically, and then you get in balance and everything else falls into place. When our bodies are performing at best, you will have less illness, less chronic disease. Obviously, life happens and acute situations happen, traumas happen, accidents happen. There are things that are out of our control. However, we can only do what we can do. As I say to my patients, do your best and leave the rest. And East Asian medicine is a big part of doing your best. One other thing I have to address is the amazing herbs of Chinese medicine. They've been around a very long time, and they address more than you would even know. Not only do these herbs address the different organ systems, i.e. you might have like shanjuyu, which is dogwood fruit, which basically helps with sperm motility. People don't realize this. Or you have fuling, which is Dioscorea poria, and it helps to actually reduce inflammation by draining damp. There are herbs that help soften masses for thyroid. There are herbs that help soften masses regarding specifically ovarian tumors and uterine tumors. We have these herbs that are cheap and they're at our fingertips and they've been used for decades. They're in textbooks, they have clinical studies, and they're there for us. And 90%, if not more, of our community isn't utilizing them. And it's a shame and it's a crime, I feel, then for me to not share this information with you. So I can only touch on the very basics on this episode, but know that there are hundreds of single herbs. Most of them are plant-based. They come from nature. Some are shells, so you have to be careful with that. Some definitely do come from animal, so you have to be careful with that. But the majority of them are plants, and they're based on the stems, the roots, the leaves of plants. Or they're things that are in our grocery stores. You just haven't made the connection to how that helps your health. There is a world of herbs that have been around for decades that have had clinical studies, that have been published in textbooks, have been utilized in tandem with allopathic medicine. They have helped so many patients regarding fertility, pain, tumors, cancer prevention, sleep issues, urinary incontinence, fibroids, thyroid issues, cholesterol reducing, blood pressure reducing herbs that we can use in tandem with your allopathic medicine to help you either reduce the medication dosage, reduce symptoms or side effects, or even get off those medications if it works for you. There's a world out there, and you haven't even begun to touch on it. So I'm excited to explore all this with you. Thank you for listening and being a part of the conversation today. If you enjoyed it, please like us or leave a comment in the comment section. We would love your feedback, and we are open to topics that you would like to discuss. And better yet, if you know anyone that may benefit from this information, either they're suffering, they're in pain, or they're just curious about trying this medicine but they don't like needles, please share this podcast. As I always say, wellness is as contagious as the flu.